I'm Dr. Daryl Dykes, and I would like to discuss reverse shoulder arthroplasty. Reverse shoulder arthroplasty is for patients that have both an arthritic shoulder and no rotator cuff. This in the past was a very difficult problem to deal with. There really wasn't a great solution, but the engineers in the orthopedic world have come up with a nice solution to bail out a shoulder that is severely injured like this. The average patient is somewhat older. Rotator cuff tears become much more common when you're in your 70s. The evaluation would consist of an x-ray showing that the joint is bone on bone. Often the humeral head, when the rotator cuff is torn, the humeral head rides up on the socket. It's no longer well located in your normal shoulder socket, and this combines to create a thing called rotator cuff arthropathy, which is leading to severe degeneration of the joint. The way we fix this nowadays is an incision in the front of the shoulder. Go in and remove the diseased head of your humerus and resurface the scapular side of the joint with a unique ball design. The reason is a reverse shoulder is the standard person and standard anatomy of the shoulder is the ball is on the outside, the joint is on the inside. When you do a reverse, you are in effect switching that around. You reverse the alignment of the joint. This type of device allows the shoulder to be converted into a fulcrum. The primary thing that you need is a functioning deltoid, which is the large muscle on the outside of the shoulder. As long as you have a functioning deltoid, you do not need a rotator cuff for this type of device to work, and is an excellent bailout procedure for patients in this situation. The way it is performed on the scapula, there is a ball that is attached to the scapula. It usually consists of a base plate with multiple screws that are locked into the scapula, and the ball is rigidly attached to your shoulder blade. On the other side, the humerus is planed. You take off the head. The opening in the humerus is broached open to accommodate a stem. There's porous coating on the outside of the stem. This is inserted and impacted in the bone. It's press fit into the bone. As soon as it goes in the bone, it's rigidly fixed to the humerus, and this allows us to place a tray or a new shoulder socket on the top of your humerus. This locks into the stem. Once it is in position, we then do a reduction on the shoulder. You pop the humerus back into place, and the tray articulates with the new ball. This allows very reasonable range of motion in the shoulder, both for extension, flexion, abduction of the shoulder, and gives you a functional, painless range of motion. Of note is that with a reverse shoulder arthroplasty, the range of motion is not as great as with a total shoulder arthroplasty. As you can imagine, this is a mechanical device, and as you move it around, it has limits on how far the humerus can traverse across the surface of the ball. That being said, we're looking for a functional range of motion in the shoulder where you can get the arm up in an abducted position, where with a functioning elbow, you can get your hand to your mouth, to the top of your head, ear, etc., up in this area. And for most people, you can do 90+% of what you would normally do with a shoulder with this type of device. After the procedure, most people can go home the day of the operation. We use an interscaling block where we block the nerves coming out of the side of the neck. That gives you a nice numb arm after the procedure. We also use a local anesthetic in the incision, which will help with postoperative inflammation and pain. Once you go home, the primary therapy after the procedure is to make sure you do not lose motion in the elbow, wrist, and hand. We also do some gentle, what we call pendulum exercises to get some gentle motion in the shoulder, but that's about it for the first 2 weeks, so it's fairly simplistic. At the 2-week mark, you follow back up in the office to have your staples removed. We'll do a wound check, do x-rays, and at that point, we'll start formal therapy. Certainly, if you feel like you're a good candidate for this type of operation or would like to discuss these procedures and others, please feel free to contact us at Alabama Bone and Joint in Pelham, Alabama. Our number is 205-621-3778. Thank you.